And good morning to your listeners and viewers. Yes, we are starting up today. We have more than 40 sites who are available to start up. These are the same vaccination sites that were functioning before the pause. Most sites will start up today. There are a few sites who are still waiting for their local ethics approval. And as soon as that is received, then they will start up as well.
Of course, the sites you're talking about are part of the phase 1 process, and we need to clarify this. This vaccination process that's resuming is to complete phase 1. We're not moving into phase 2.
Yes, that is correct. So as part of the Sisonke study, we have committed to vaccinate 500,000 healthcare workers through an early access Sisonke study. We vaccinated more than 292,000 healthcare workers before the pause. And so we have the remaining doses to complete. And so by the 14th of May, we hope that 500,000 healthcare workers will have been vaccinated through the Sisonke study.
So just take us through the confirmations that have come through in terms of the safety and the efficacy that allows for this process to resume.
Okay, so as you know, when we started the Sisonke study, we already had phase 3 data that was available for the J&J vaccine. And because of that, we were allowed to proceed with the phase 3B open label study. Then we paused the study because of a concern about clots. The pause allowed all regulators to review the data that were available. For the J&J vaccine, at the time of the pause, there were 6 such incidents reported in the USA. These were amongst women between the ages of 18 and 48 years old. They were associated with thrombocytopenia, so they were quite a distinct clinical syndrome. And since then, 2 more have been reported. So it occurs about 1 in a million people vaccinated, so the chances are rare. The risk is higher in women who are predisposed to clots, so either they've had it before. And so at the moment, we have amended the protocol to make sure that we have a screening process before anyone is vaccinated. We ask about whether anyone has had a previous sensitivity to a drug called heparin, because that is also associated with clots, and the syndrome that we see with the J&J vaccine mimics that syndrome as well. And we ask if people have had a previous history of clots. If someone has, then we do refer them to the safety team, and the safety team decides whether they should proceed with vaccination or not. So the risk is 1 in a million. What we say currently is that the benefit of vaccination far outweighs the risk for the general population. And certainly amongst healthcare workers, we are quite, we really want to get them vaccinated before the start of the 3rd wave. But of course, vaccination is voluntary.
There have been general concerns about the slow pace of progress in vaccinating, in getting shots on arms. How many do you have a sort of time frame in terms of when you can finish this process, and are we on track to start phase 2?
Okay, so I can speak about finishing the process through the Sisonke study. So we have vaccinated up to 13,000, sometimes 14,000 healthcare workers a day nationally through the sites. Remember that the vaccination sites in the Sisonke study are limited. They are research sites. They are vaccination sites paired with the research sites. So we anticipate that we will be able to complete the vaccination of 500,000 healthcare workers by the 14th of May. The transition to the phase 1B, which is the rollout, will occur as soon as vaccine is available. Researchers are not integrally involved in that process. It will occur through a routine National Department of Health sites, and hopefully through large community halls and sports fields as well. So the potential to vaccinate large numbers of people per day is high, providing one has these large sites open, vaccinators trained, room available or space available to monitor safety and to do the observations for 15 minutes post-vaccination. But I think the potential for vaccinating large numbers of people per day is high because the number of sites that will be open under the rollout is much higher than the number of sites that we opened up under the Sisonke study.
You have previously clarified this to our viewers, but just for the benefit of those who don't as yet know, just clarify for us again. You keep referring to the Sisonke study, which is different from the vaccination rollout process. Just help us to navigate these technical processes.
Okay. So when we started the Sisonke study, the J&J vaccine had not been approved by the regulator in South Africa, but there was phase 3 data available to show that it is safe and effective. And so in that interim period, while we were waiting for the regulator to approve the vaccine, we were able to offer vaccination of healthcare workers who are a particularly high-risk group, through a research study, so through a research program, research study, whatever you would like to call it, and we call this the Sisonke study. Because it was offered through the Sisonke study, anybody who then was vaccinated through Sisonke had to go through a process where they registered online as per usual on EVDS, but then they got a follow-up message to say, please review the patient information sheet and consent to participating in the study. And so the healthcare worker would go through the patient information sheet, answer questions to make sure that they understood what they were engaging in. And then once they confirmed, that went back into the system and they received a voucher for vaccination. And that occurred because the regulator had not yet approved the vaccine for use. With the rollout, the J&J vaccine has now been approved for use. The rollout will proceed. Obviously, consent is needed as one would need consent for any medical procedure. But in the rollout, this would not be consent to participate in the study. So the Sisonke study came in to bridge the gap and to make sure that we offered vaccinations to healthcare workers as part of an early access before the start of the third wave to protect healthcare workers. So I hope that clarifies the difference between the two.
Well, we hope so too. But as always, thank you so much for your time.
Thank you. Thanks very much.
And we can now confirm to South Africans that the resumption is now on. Health workers are now getting vaccinated. And that was Professor Ameena Goga, who's the co-principal investigator for the Sisonke study.